The Cuban lung cancer vaccine by Clemencia Pinasco. So, what is the problem? The problem is lung cancer. What is lung cancer? Lung cancer is the uncontrolled growth of cells in the tissue of your lung. Lung cancer is usually caused by exposure to tobacco, smoke, or frequent smoking. What is the solution that Cuba created? After 25 years of research, they created Simavax EGF. It's a lung cancer vaccine that attacks the already existing cancer, but does not prevent it. It just attacks the effects that are in your body. What are the benefits of this treatment? Well, first of all, limits the effects of the cancer in your body, making it a more manageable disease. It helps the body produce antibodies that will help your immune system and aid you in fighting any other infections or colds or any other thing that you might get from the outside world. It has few side effects as it is made from a protein that will only attack the cancer cells, leaving the other cells unharmed. And finally, it prolongs the life expectancy of the terminal cancer patients. But it also has its limitations. First of all, it is not a preventative drug. It will not get the cancer completely rid and out of your body. It will just attack what's there. Then it is used as a last resort when the cancer patient does not respond to any other therapeutical treatment like chemotherapy or radiotherapy. Once it is proved that they are not responsive to any other treatment, Simavax is used, but it is used rarely as it is a fairly new drug and it is hard to find. It is not available anywhere in the world as it does not have approval of some health regulations in certain countries because it has not been tested there yet. What are the social interactions that a Simavax has? First of all, it prolongs the life expectancy, giving more time for the person to do what he wants and enjoy the last moments of his life. The average life expectancy after terminal cancer is diagnosed with no treatment is 4 to 6 months. With therapeutic treatment other than Simavax, like chemotherapy, is 10 months. And if Simavax is used, it's about 2 years. But Simavax isn't only about the quantity of life, it's also about the quality. For example, if you get chemotherapy, you're tired, your immune system is destroyed, making you very vulnerable to other infections or colds. You lose all your hair, you're tired all the day, and you have to go to a hospital and stay there for hours while you get the treatment. On the other hand, it has very strong side effects. And those 10 months that it prolongs are spent laying on your bed, tired, not being able to do any daily work that you used to do. On the other hand, Simavax has few side effects. It obviously won't put you up to your feet and make you feel completely healthy, but it makes this chronic disease more manageable. What are the ethical and economic interactions? First of all, the cost and the access of the medicine. This is a very costly treatment, and there's a clear barrier of who can access it. There's a great limitation in the economic area. And then, if health institutes and government fund the purchase and the treatment of this for other people, giving it free for a very low price, is this investment worth the amount of people is it benefiting, or should this money be spent in other areas such as infrastructure or education or anything else the government wants? And secondly, if this treatment would be funded, what factors would decide who gets the treatment and who doesn't, who lives longer and who doesn't? Will it be completely transparent with no corruption. These are all ethical issues that people have to deal with when they make these decisions. Then how does this attribute connect with my no? How does this problem connect with my attributes? Well, it's really straightforward. My attribute said that Cubans have a very strong infrastructure for medicine research, and they have great medicine research in their country. Well, first of all, they researched this for 25 years, and when they finally had this huge scientific breakthrough for a vaccine for lung cancer that acted effectively and with few side effects, they basically created a medicine. It's really straightforward.